I'm going to be continuing my presentation this morning on measles. Okay, so complications, we're just going to go back over that again. So some of the complications of measles that can be mild or life-threatening: dehydration, bronchitis, laryngitis, pneumonia, blindness, brain swelling, and of course, death is also a possibility with this. So what are the treatments for measles? Now, this is controversial. Everywhere you go, there's a controversy. So I'm just going to go through a few things, okay? There's no specific treatment for a measles infection once it occurs. Treatment includes providing comfort measures to relieve symptoms, such as rest, staying hydrated, and treating or preventing the complications. However, some measures can be taken to protect individuals who don't have immunity to measles after they've been exposed to the virus. So post-exposure vaccination. So people without immunity to measles, including infants, may be given the measles vaccine within 72 hours of exposure to the measles virus to provide protection against it. If measles still develops, it usually has milder symptoms and lasts for a shorter time. Then you have immune serum globulin. So pregnant women, infants, and people with weakened immune systems who are exposed to the virus may receive an injection of proteins, antibodies called immune serum globulin. When given within 6 days of exposure to the virus, these antibodies can prevent measles or make symptoms less severe. Okay, so fever reducers, antibiotics can be given as well if a bacterial infection, such as pneumonia or an ear infection, develops while the adult or child has measles. The healthcare provider may prescribe an antibiotic. So that's going to be up to your healthcare provider to prescribe that. Now, here's one thing I know is controversial in a lot of discussions: vitamin A. So children with low levels and adults with low levels of vitamin A are more likely to have a more severe case of measles. That is true. So giving a child vitamin A may lessen the severity of measles infections. It's generally given in a large dose of about 200,000 IU for children older than a year. Smaller doses may be given to younger children. So you want to speak to a healthcare provider on getting the exact dose for your child, okay? So some people think about whether or not, do I have chicken pox or do I have measles? So I want you to know the difference. Measles and chickenpox are both highly contagious viral infections that cause a characteristic rash. While they share some similarities, there are key differences between the two diseases. Both diseases spread through contact with respiratory droplets from an infected person, such as through a coughing, sneezing, or just talking, okay? So measles typically manifests with a high fever, a cough, runny nose, red eyes, and a rash that starts on the face. On the other hand, chickenpox commonly includes symptoms such as a fever, not as high, low grade like 101 or 100 or thereabout, headaches, tiredness, and an itchy rash that starts on the body. So again, chickenpox is going to start on the body, the measles is going to start on the face. And that's how you typically know the difference. And measles sometimes look like heat rash. So you also want to make sure you know the difference as well. Okay, so you want to follow up with your provider on that. So, can you prevent measles? The measles vaccine is extremely effective in preventing the measles. I know people are controversial about vaccines. I'm not trying to force this onto anyone, just want to give you, from a medical perspective, some of the facts, okay? So to be fully protected, persons need 2 doses of the MMR or the MMRV. And a lot of us have gotten these things in our childhood, so they can also do titers for you when you're going to school or you're starting a new job for you to know them, okay? So vaccination is like a superhero shield against serious illnesses like the chickenpox and measles. It is a special way to train your body to fight off these diseases if you ever come into contact with them. And here's why it's super important. Staying healthy. Getting vaccinated helps keep you and your loved ones healthy. It is like wearing an armor to protect yourself from getting sick, prevents spreading. Vaccination not only protects you, but also helps stop the disease from spreading to others. It's like building a fortress around your community to keep everyone safe. Avoid serious complications. So chickenpox and measles can be sometimes lead to serious problems like pneumonia, brain swelling, death. But with vaccination, you can lower the risk of these scary complications, right? To save lives by getting vaccinated, you're not just protecting yourself again, you're helping to save lives. Vaccines have been proven to prevent millions of deaths worldwide. And again, I'm not forcing this on anyone. So whether it's chickenpox or measles, vaccination is a superpower to stay healthy, to keep those around you. Don't wait. Talk to your doctor about getting vaccinated today. Okay? And yes, I know God will protect us, and He is our protector and He's our healer, but He also gives us wisdom. And so He provides medicine for a reason. So in conclusion, measles outbreaks still happens, and people still die from measles. If people stop getting the measles vaccination, it can start spreading widely again. If you think you've been exposed to measles, talk to your healthcare provider. They can let you know how to manage your symptoms and if there are any ways you can reduce your risk of severe illnesses. As many of you may have been seeing the news here in the US, we've had a few deaths lately when it came to measles, and these people were all unvaccinated. I want to give special acknowledgement to the Mayo Clinic, CDC, and the Cleveland Clinic for the information that I provided you today. I hope this was helpful, and I hope you take some wise counseling when it comes to these diseases. I love you. God bless you, and enjoy the rest of the service.